We know that everyone has a brain and everyone has a spine. There are various kinds of diseases which afflict the brain, such as brain tumor, brain hemorrhage. You may be born with a brain abnormality, such as water collection, hydrocephalus. You may have a road traffic accident where head injury is very common. You can have various kind of infection, and Tanzania being a tropical country, people are prone for those infections, more so for conditions like tuberculosis, and even HIV related illnesses can affect brain. The second major part of my specialty is spine, where I deal with the neck, back, mainly disc problems, a bad spine which requires correction, spinal tumors, and even road traffic accidents affecting the spinal canal and spinal cord. Now, some diseases we may be prone to. Some diseases are genetic in nature, and we can always blame our forefathers for that. But some of the diseases are lifestyle related, where only we can blame ourselves. So I'll dwell on lifestyle diseases. The common lifestyle diseases which lead to further worsening in the conditions are diabetes, hypertension, obesity, and I will even say road traffic accident is mostly a lifestyle disease, because we move in the car, we move on the motorcycle, high speed life. So even the road traffic accident, lifestyle has a lot to do with it. Now, coming to a specific of lifestyle diseases, we'll go to the back and the neck. We know that 3 out of 5 people of working population, that is a population between 25 and 50, will suffer from back and neck diseases. They are getting more common, partly because our lifestyle is mainly sedentary, sitting for a long time, not doing exercise. We have become obese. Especially Tanzania, people are genetically prone for being obese, and on top of that, the lifestyle, the food habits can lead to more obesity. The more obesity, the more pressure on the spine. The more sitting, more pressure on the spine. Less exercise, more changes in the spine. The second part, exercise will reduce obesity, which will further decrease diabetes, hypertension, and spine-related issues. Chances of hypertension, diabetes will dramatically come down with exercise. So this is lifestyle diseases. Then second thing is infection. Infection is also a very common problem. For few of the infections we have vaccines. For few of the infections we must learn to recognize them early and treat them early. Tuberculosis can be treated very easily, but if it is delayed, can be one of the biggest killer. Then third comes tumors in the brain and the spine. Of course, no one is to be blamed for that. It is God's gift. Sometimes it's genetic in nature, but mostly it just comes as a chance. Now, you can't prevent tumor from coming, but definitely you can detect it early. And if you can detect it early and offer early solution, then your life, quality of life will always remain better. The fourth issue comes to accidents. Now, I must say that Tanzania has got one of the best driving rules, and people are generally very their driving is pretty good. They don't speed, but of late I have been watching that there are two-wheeler accidents which have become more common. Now, who drives two-wheeler? A young person. And the young person, if he becomes paralyzed due to head or spine injury, not only he loses his own profession, it affects the family severely, because taking care of a paralyzed patient is very expensive and it does not give you any benefit to society. So one must learn discipline on road, one must drive with helmet, should not drive with high speed. So that is the next thing I would like to mention.
In fact, there are a lot of painful conditions and painless conditions. Most people don't reach the doctor if it is a painless condition. For example, if there is a mouth sore or if there is hoarseness of voice, but without pain, people don't reach the ENT specialist on time. Whereas they could be hidden cancers or they could be precancerous conditions, and that is why any abnormal symptom, even though it is not associated with pain, should reach the ENT doctor. Today, in fact, in my outpatient conducted here in Dar es Salaam today, there were a lot of people with deafness and they were not undergoing treatments. I would like to tell the general public that people with deafness or people with discharge from their ears should always get it evaluated. There were few people who had holes in their eardrums. If they don't get timely treated, the deafness could be progressive. Then there are other congenital causes where children are born with deafness, and there are treatments. Don't lose hope. There are treatments like cochlear implants even for congenital deafness. So we implant a device in the inner ear, and these people have good results, and they followed up with rehab, speech therapy, etc. If there is a condition which needs surgery, one doesn't have to fear anymore. Why? Because there are so many advanced newer endoscopic and robotic procedures nowadays, where the stay in the hospital is very short. There is no blood loss. Even in conditions like throat cancers or thyroid surgery, we can even do scarless surgery. Patient doesn't have to have cosmetic disfigurement. There is no morbidity post-operatively, which means the pain is minimal. There are no extra feeding tubes or accessory breathing passages as it used to be before. Traditional surgeries are moribund surgeries. The patient has to suffer pain as well as post-operative cosmetic disfigurement for a long time. Now, with the advent of newer endoscopic and robotic procedures, now these no longer exist. Patients can be discharged very fast. The recovery is very fast. And the need of antibiotics, the need of anesthetic drugs is very minimal. As the recovery is faster, you do not touch the normal tissues. It is only the diseased area that is removed. With the advent of PET scan, like in our hospital, we have PET scan imaging, which is very good for diagnosing early cancers and also to follow up them with yearly PET scans after any cancer is treated. Based on the grading and staging of cancers, even like head and neck cancers, whether the cancer is in the tonsil or in the tongue, these newer treatments can be done with lot of good outcomes. Patients' functioning remains normal, like speech and swallowing. And also there are many other conditions in ENT which people are not aware of. Most people think ENT is all about just common cold, whereas there is various ailments pertaining to the ear, nose and throat. Now, for example, there are people who ignore their snoring issue. Snoring is very common in every family. There are a lot of people who snore, and they do not know that snoring is associated with a condition called obstructive sleep apnea. Now, what is obstructive sleep apnea? Along with snoring, patient has repeated pauses in breathing. The breathing stops for few seconds multiple times during sleep. Now, this condition can be very dangerous because such people can have silent heart attacks during sleep. Such people have 10 times more risk of heart attacks and brain strokes and cancers. That is why anybody who snores should go to the ENT doctor for a simple evaluation of the upper airway, may need a sleep study, that is 1 night monitoring of sleep, and following which this can be corrected. In fact, in olden days, there used to be only CPAP, that is, there used to be a breathing device like continuous positive airway pressure, CPAP or BiPAP, which even now a lot of people are advised. But this is not the only treatment anymore. If the candidates are selected well, their snoring can be cured. Their obstructive sleep apnea, if there are mild cases or if they have moderately severe sleep apnea, with the advent of newer robotic procedures in which midline glossectomy is done, where you remove blockages from the upper airway, patient's quality of life improves, patient comes off the antihypertensive drugs, the patient's sugar control gets better. So as the sleep apnea gets cured, memory comes back to normal. Patients feel very energetic.